Good morning, everybody. Just as a point of order, if we could ask you to put your mobile phones on silent. You don't need to turn them off. You'll see a hashtag up there, and if you're interested, please tweet away. We've no issue with that whatsoever. There was a safety demonstration earlier on. The doors and exits are as you see them. Just make certain that you get to the closest one in the case of anything disastrous happening. My name is Keith Wood. I am the chair of the Healthy Ireland Council. The council stemmed from the framework document that was launched in 2013. This was described as an excellent starting document by Margaret Chen from which to work, and of course it is, but it also highlighted the scale of the ask. As we started on our journey through making the council effective, certain issues kept cropping up. We were all earnest, having all had an input in our own sections in health in Ireland, with our own ideas and, to be honest, our own agendas. After the first number of meetings, I felt that as a group, we were far too disparate, too unwieldy as a council of volunteers to achieve any real level of consensus. But those potential flaws are the saving grace of the Healthy Ireland Council. There is no silver bullet to fix the health of Ireland. The solutions to be healthy in body and mind are the responsibility of all. That is, all government, all parties, all society, and all Healthy Ireland councillors. The only consensus we need is that everybody has a part to play, however big or small, however local or national, however young or old. The difficulty we had as a council, having to articulate a single vision, we believe, is actually a large part of the solution. We all have differing ideas, but we all have a part to play. The conversations around the centenary celebrations of 2016 provided the template. We need to make Healthy Ireland front and centre of what it means to be Irish in this second century as a nation. That to be Irish is to be healthy in body and mind. This Healthy Ireland network is a movement, a conduit for this to change and for it to be true. We have examples of past performance to show us the way, from the smoking ban that gained traction and swept the nation, to the role of the Special Olympics in 2003, leading the way in destigmatising intellectual disability and showing the ability and capabilities of people with an intellectual disability. That is the potential of the Healthy Ireland Network, a movement that supports healthy living, makes it easier, and helps remove the many burdens and hurdles. The Healthy Ireland Network starts today as something small, but can grow to become the communication centre for change in the health of our nation in the future. Within this movement, it is top to bottom, becoming the responsibility of the government to reference Healthy Ireland in its thinking when looking at changes in policy, to individuals in our community taking their neighbour for a short walk in the park, knowing that being in nature increases not just our mood and attention capacity, it transforms our attitudes towards ourselves, others, and notably the environment around us. This is all-encompassing because it has to be. It is also collaborative, and we will hear examples on this later on. There is a phrase that if everybody is responsible, then nobody is. We would like to turn that on its head. We are all responsible, and we all have a part to play. Before I bring up the Taoiseach, I just have some very important thank yous that I want to get through for getting to this part of today. The Healthy Ireland Council, the full council, their attention over the last 3-year period to try and get this network together has been pretty amazing. It's been very, very tough, but they've stayed the course throughout. But I'd like to highlight the sub-group in particular. Stephanie O'Keefe, Colin Regan, Suzanne Costello, John McCormick and Maureen Kavanagh. Their input has been absolutely invaluable. Thank you also to Prospectus for all the work they had in managing the project, and thank you to Kate O'Flaherty's team in the department, especially Aoife O'Brien and Mary Ryan, for putting on today's event. I'd also like to thank the exhibitors at the back to show you what the Healthy Ireland Network means in reality. This is a concept, a conduit, a communication tool, but the reality is in the back of the room down there. On a personal level, I would like to acknowledge the influence of Professor Pat Duffy, who led me to Healthy Ireland with his vision and who sadly passed away 2 years ago. To Donal O'Shea for his guidance and clarity in the last 3 years, and to Kate O'Flaherty for her tireless work and her absolute can-do attitude. And on that point, I'd like to bring up Taoiseach Enda Kenny.
Thanks very much. Good morning. Not often you get a person of the international reputation of Keith Wood to head up something like Healthy Ireland, and I want to compliment him and thank him for sticking with this for the last number of years to a point where today is a really important day. I live in... Thank you. He was a fearsome sight with that green jersey. I live in Castlebar, and we have a line of lakes called the Church Lakes, but one of them sort of has an inner bay to it, put it that way. And about 10, 12 years ago, said we should put a pathway around this, put a little bridge across the gap and make it. So it's a kilometre around. Actually, it's been the best investment in the health of that town in 50 years. There's so many people, young and old, either run it, walk it, buggies. There's a social engagement, interaction, they talk, have a cup of tea, have a cup of coffee. It's part of life. It's only a small example of so many things that can happen. I have to say I'm very impressed by what I see at the back. Everything from mental health to retina, the bowel screening, the Sports Ireland, all the different clubs, the healthy diets. But in so many places where there disadvantage applies and neglect and forgetfulness and all of that. And yet it's too easy to go for the deep fat fries and the chips every evening. I was in a town not too far from here a number of years ago. It was a really hard working estate, a lot of problems. There were 17 rooms in the local school and 10 of them were vandalised. Everything went on that you could imagine that shouldn't go on. And then the principal teacher changed. Somebody came along and said, I'm going to do something about this. And began to talk to the mothers. Instead of the kids being fed on sweet bars, going to school and sugary drinks, he brought them all in and cook every morning an Irish breakfast for kids. Sausages, rashers, black puddings, eggs, as much as you could eat for very little. And when their stomachs were full, they were then able to learn and understand. The other school said, God, these people can learn Spanish and do computers. Change the whole ethos, and Anya Brady will know this. Change the whole ethos of the school. And instead of the place becoming a centre for public vandalism, it became a place of public interest, that you could do a course in pigeons or cats or engines or whatever it was. And out of that transformation came a whole ethos and culture of improve yourself. You can do better than where you were headed, and that's where we need to be. And I often say, and said this to Marcella a few times, that we have celebrity chefs who are very good, and they do wonderful work, and they're quite willing to engage in schemes that would say, let's go to places where people haven't had the wherewithal or the know-how to rustle up very healthy foods at a fraction of the cost of what they use at the moment. And we should engage in that and show communities that where that disadvantage applies and it's on a drift to the bottom, that you can actually arrest that and say, we've got a better way of showing you what you can do with your kids, and you'll have more to spend on things that you need at the end of the day. I'm impressed by the vision of Healthy Ireland, where everyone can enjoy physical and mental health and well-being to their full potential, where well-being is valued and supported at every level of society and is everyone's responsibility. It's not them over there, the government or the department or the minister. It is everyone. Because when you close the door, it's still everyone's business. And the purpose, as stated, is to establish and grow an empowering national movement. That everybody should understand this is why we should engage in these things. I see Charlie Lambert down here, Been on the bike with Charlie a few times doing charity gigs or whatever, or healthy gigs. I was saying to Keith, I was down in Sligo on Saturday. Did a 60k thing there for cystic fibrosis and for the Northwest Hospice, where they give people such wonderful care in their last days. And the man on the radio said, "Why do you do this?" I said, "Well, I do it because the time will come when you can't do it. And you should do these things as an example of, motivation for other people to say, you too can make a contribution, even if you can only travel a half a mile or half a kilometre." I made the point that talk to anybody who's in the hospice. They give every cent they ever earned to be able to go back out and cycle 100 metres on the bicycle on a sunny day. And the old saying that our forefathers taught us that health is wealth is so true. Because it's only when it slips from you or that you run into real difficulties that you can understand that maybe it was preventable. Maybe it could have been arrested before you get into that difficulty. So I just want to say that thank you, Marcella, for the work you've been doing along with Keith and Healthy Ireland over the last number of years, Dr. Stephanie and everybody else. This is about us all, and it's about our futures, and it's about our future well-being, young, not so young, and children. And as Keith Wood has said to me, he's right. If you get them in the schools and they go home and talk about it, Mommy and Daddy and whatever might well decide, say, we should do this as well. Because if the children like it and it's good, well, then we should follow on from that. Like the last 100 years have seen enormous developments and changes in so many things. Last 20 years, never mind 100. So if we strive for an inclusive and vibrant Irish society, see, when I have the opportunity to go to so many places abroad and talk to business and talk to young people, they have this image of Ireland now as being an exuberant, enthusiastic, active, healthy country, and yet we know that we've got challenges here, whether it be obesity or too much time on the hand computers or whatever, and people not inclined to understand that the body's made for movement as well as anything else, and that the opportunity is there in so many ways. And I would like to say publicly to the hundreds of thousands of volunteers every weekend who go out there for nothing, and whatever sport they're involved in, it's so good that they be active. And that's given by parents and guardians and those interested every single weekend right across this country. And we should be able to understand that even with all of that, there are still some who are vulnerable that we can actually look after. So the Healthy Ireland framework is one that acknowledges and promotes the fact that everybody has a role to play here. And even if they only walk 100 metres, they walk a kilometre. Sonia O'Sullivan used to go into shops and say, "Come on, let's go for a little jog here for 200 metres. I didn't do this for 20 years, and here we are. Mr. Woods runs up and down hills. Easier going up than coming down. Like me, my knees are not 20 years of age anymore. So, of course, our background was GAA, and I'm glad to see that so many sports, basketball, lacrosse, rugby, association football, all the other things are all there. And the gear is so cool now. There's a word in this note here for the mammals. And yes, you know what a mammal is, don't you? A middle-aged man in lycra. I said it should be changed with middle-aged, overweight men in lycra is even better again. They're mammals with purpose. In any event, it's all part of the solution this year. So I suppose our challenge really is for those who are in positions of, either responsibility or communication, to be able to constantly remind people that they can do better and that there is help available and opportunity, and that they should walk and take active exercise, should eat better than they're eating, mind the drink, the cigarettes, all this stuff, that the attractions and the pressures that are out there on so many people, we can do better. So I just want to say thank you, Keith, for setting up the council, for seeing it through to today. Dr. and Marcella, this has been your political responsibility. You've done a great job on it. And I hope that this actually will be, if you like, an entity that will grow in importance and understanding over the next 20 years, and that every baby that's born will grow up in a home where whoever is minding them will be able to say, look, here's the way you should conduct yourself. Here are the opportunities. You can, if you want to live to be 100 and be active and healthy, you can. I got a phone call from a fella there recently. He said I was in Australia. I said, what were you doing in Australia? He said, I won 2 medals. I said, what were you? He said, I got a silver, he said, in the silver in the long jump. And he said, I got a bronze in the high hurdles. He's 80 years of age. And he said to me, he said, yeah, and the fellow that bet me is from Finland, and he's 86, and I'm going to beat him next year. Thanks very much.
Thank you, Taoiseach, I think, for reminding us that this is a very serious topic, but you're supposed to enjoy yourself as well at the same time, which is very important. I don't cycle for the very simple reason that Lycra just doesn't suit me. And actually, even though it's easier on the body to run up the hills, gravity makes it very fast to run down it. I also want to thank him for highlighting again the benefit sitting within communities to be involved in the health of other people within that community. That is something that's absolutely integral to how this will work in the future. And finally, I'd like to thank him that on this particular day for making this the key part of his morning. So thank you very much, Taoiseach. Our next speaker is somebody who definitely has the body physique for a long-distance runner, Minister Simon Harris.
Thank you very much. Good morning, ladies and gentlemen. I'm so pleased to be here with you today on what is a really, really positive and significant day in terms of the further development of Healthy Ireland with the launch of the Healthy Ireland Network. And I too, like the Taoiseach, would like to thank Keith for his incredible leadership, for lending his name and his reputation and so much work and effort, along with all your colleagues on the council from so many different sectors of society, to getting us to this point. And I want to thank my colleague, the Minister for Health Promotion, Marcella Kennedy, for her tireless work in taking on what is often the vested interests and not the easy challenges in saying we must make changes in this area because we are in the Department of Health, not just the Department of Sick, and it has to be about making our population healthier. I want to really sincerely thank the Taoiseach for being here today. In fact, I want to thank the Taoiseach for an awful lot, but there will be time to do that on another occasion. But I think the fact that the Taoiseach is here with us this morning is a continued example of his commitment to this agenda and to recognising that creating a healthy Ireland is not just the responsibility of the Department of Health or only one or two ministers, but the responsibility of all of government and indeed of all of society. Improving the health and the well-being of the population has to be a primary concern for all of us. We have a ticking time bomb when it comes to a number of health-related conditions, and if we don't change the way we live our lives, the way we eat, the way we exercise, we as a country are not going to have a sustainable health system, no matter how many resources we put in. We need a serious mindset change. So supporting people to live healthy and independent lives has to be one of our key objectives, not now, but just right into the future as well. The Taoiseach has already alluded to this fact, but we're going to see a significant rising trend in terms of chronic diseases in this country, and so many of them are preventable if we inform and educate ourselves as citizens, and particularly from a young age. The mind of a young person in school, like a sponge. If we can teach our young people how to live lives healthier and continue that trend, let them take it back into the home, back to their grandparents, back to their community, it's so, so important. And that's really what the Healthy Ireland framework is all about. It sets out not just the scale of the challenges we face, which is certainly not unique to this country, but it also sets out solutions. It sets out a blueprint about how we go about addressing this challenge and addressing it not just purely as a health service, but addressing it as a country as a whole. When I had an opportunity to address the Oireachtas committee recently that's charged with coming up with a 10-year plan for the future of healthcare in this country, I didn't just talk about more hospitals or more hospital beds or what we do when somebody gets sick. I very purposely made a point of emphasising that we've got to actually look at how we can make our population healthier. It has to be the blueprint for the wider work across government in addressing all of the various public health challenges we face, and in shifting our focus much more to population well-being and to disease prevention, as well as to health inequalities. The point that Taoiseach makes, disadvantaged communities in this country, the population there have to have every equal opportunity to live a full and healthy life, just like people in every other part of this country. So I think there's a growing recognition in this country that there is a need to invest more in the health of our people, not just through investment though in the traditional health services, but also on the broader range of services that support and maintain a healthy population through positive impacts on each and every family's daily lives and their ability to have a decent quality of life as well. I think it's fair to say we have made a good start in this country. through the work of the Healthy Ireland agenda. Since it was launched in 2013, there's been a suite of policy measures implemented, from obesity strategies to physical health, sexual health. We've seen cross-sectoral implementation of all of these policies. Again, so important, pulling different strands together to actually try and drive implementation. And this work is being led by the Health and Wellbeing Division in the HSE, which is embedding and strengthening the Healthy Ireland agenda into all aspects of what we do in our health service. But again, I do want to emphasise the point, because this is why you're all here today. Healthy Ireland is not just the job of the Department of Health, it's not just the job of the HSE, and it's not just the job of government. It is the job of all of us in society, whatever our role is, however we are interacting with our citizens. And there are so many of you here today that interact with people on a daily basis, people that the health service don't come across, people in our sports clubs, people in our schools, people in our active retired groups, people in cancer support groups, people in right across there. Where are you from? People in the active retirement, exactly, yeah, I can see people in the active retirement. Right across society, we need to provide opportunities for everybody, from the youngest to the oldest. And that's why we need all of you on board, because the sheer scale of this challenge is absolutely massive. It does necessitate buy-in from all of us, from all government departments, but from everybody in society. And I just want to very briefly, I suppose, point out to you some areas where we already have work underway. We now have the Department of Education and Skills supporting the new wellbeing curriculum, impacting on our youngest citizens. We have the Department of Housing, Planning and Local Government supporting local authorities to embed national health and wellbeing policy at a local level, at a community level. We have the Department of Jobs, Enterprise and Innovation developing a healthy workplace framework, making sure people aren't just sitting at the desk all day, long hours, actually getting up and moving around the workforce, having an opportunity to eat healthy in work and to exercise as well. We have the Department of Children and Youth Affairs achieving outcomes of active, healthy children under their Better Outcomes, Brighter Future policy. We have the Department of Transport, Tourism and Sport developing its own physical activity plan. And we have the Department of Communications, Climate Action and Environment with its Warmth and Wellbeing pilot to assess how we deliver energy efficiency works to the homes of people with chronic respiratory diseases. So we're going to continue to drive on with all of these initiatives. But our appeal today, and the purpose of today, and the purpose of the Charter, is to ask everyone in this room to drive on with us. Because in signing up to this Charter today, you're signing up to take a piece of the Healthy Ireland agenda back to your community, back to your organisation, back to the people you work with. And I really do believe if we continue this, whole of government, whole of society, we can bring about the huge change that is already underway in Ireland. So I applaud the Council, I applaud the creation of this new network, and I really look forward to the continued support of my department in driving this agenda forward. Gyar míle magadh.
Thank you very much, Minister. And I know that you have to rush off to another engagement, but what is very great to hear in this instance is when you have a Minister for Health highlighting all the other departments that have an impact in health, all the different groups that actually have to be involved in it, because it isn't just about exercise, it isn't just about food, it is about health inequalities and social inequalities, it is about transport, it is about environment, it is about school, education, all the other different departments. And one of the elements that has come about from Healthy Ireland and the Healthy Ireland Council is that there is an enhanced sense of collaboration between the different groups and the different departments. It seems to be an easier fit. And I know that the Minister has been instrumental in having an open door policy to the other departments, which has been fantastic. Next up we have Dr. Stephanie O'Keefe, who has been fundamental to the setup of this network, and she's going to give a presentation on how Healthy Ireland is implemented in the HSE and how the HSE is a key partner and support for the network. Stephanie.
Good morning, everybody. Taoiseach, ministers, Keith, and fellow council members, and everybody in the audience. It's absolutely wonderful to be here today. 5 years ago, there was an idea and a plan of work to develop a whole of government, whole of society framework as advocated by the WHO and the EU. And there was a germ of an idea to establish a health and wellbeing unit within the Department of Health to coordinate cross-government efforts. 4 years ago, a whole of government plan was published, the Healthy Ireland Framework, setting out a roadmap for how over the next 12 years we would seek to try and mobilise and make a substantial impact in Ireland on the worrying health trends, both within defined groups of people as well as the distribution of health across those groups. A framework that set out how we intended to do that mobilisation and to address what is described in the literature as wicked problems. Problems that aren't resolved simply. They involve multiple stakeholders, multiple decision makers, multiple competing interests, multiple strands of parallel actions required to deliver change. Change in how we think, change in how we understand, change in how we lead and how we govern, and change in how we behave as individuals, at a societal level, within our own organisations. And the last 4 years, I am proud, and my colleagues are proud, and I hope that lots of people in this audience are proud as they're playing an active part. There's been a huge manifestation of work to try and bring this complex, difficult, not simple framework to life. Whether that's at the legislative and the policy levels, in terms of strategy and policy and legislation being enacted, or whether it's the significant work that's undertaken on a daily basis by leaders right across our local authority infrastructure, particularly in relation to the ageing agenda, but not solely within that space, to basically bring partners together at a very local level, at a community level, a community and voluntary pillar, with community action to try to create a local environment supporting people to live well and age well within their local communities. There's a whole range of work happening, and the slides in the background aim to give a visual representation of what this work looks and feels like in practice. Of course, the things that you don't see, but that are really important, that are being put and have been put into place, the key critical success factors to maintain and sustain this momentum over political cycles, over a period of time long enough to enable us to demonstrate an actual impact, have been put in place, whether that's around governance and leadership, and we've seen it and we're hearing it at political level, but within organisations, within key stakeholder groups who play an active role in driving and sustaining this agenda, building our teams with skills and capabilities to do this work, building and formalising partnerships and alliances and networks to make it real, mandating, planning, performance managing the work at all different levels across all kinds of organisations, communications and information and establishing common measures, research and development plans, and opportunities for us to take time to take stock, to reflect and take corrective action where we think that we need to be doing more or doing better. And over this period too, we have to be very proud to say that a central construct within the framework was to put in place a Healthy Ireland Council, and this was done under the chairmanship of Keith Wood. And over the last number of years, the Council, with the support of the Department of Health, is giving birth to this network, which is why we're here today. And this is about a mechanism that will facilitate organisations, groups and enterprises to come together to identify common goals, to lend their expertise, their ideas and their support to making a bigger difference, to moving the agenda forward at a faster pace, to building the Healthy Ireland narrative, translating the evidence within each of our spheres of influence, making a better use of public assets and investments, capitalising on the inherent congruence, and this will take a bit of time, but the inherent congruence that is there across government policy and across global agendas, whether that comes to health improvement, whether it comes to rural development, whether it's about climate change, whether it's about jobs and innovation, whether it's about housing. And as outlined in the Rio Declaration around sustainable development, the reality is that human beings are at the centre of concerns for sustainable development, and the goals of sustainable development, be they economic or social or otherwise, across our cities and across our rural counties, cannot be achieved where there's a high prevalence of debilitating illness, or population health cannot be maintained without ecologically sustainable development at the same time. Of course, my job within health and wellbeing in the health service traditionally is about the health service receiving the impacts of kind of ill health and the environment that gives rise to ill health. But my role has been about shifting our thinking and our services so that we are as obsessed about health as we are about hospitals. And the challenges facing public health and the broader context in which we work means that the challenges are too numerous and too complex for a business as usual approach. And over the next 10 years in Ireland, it really is shocking to think about it, but we will see, and we know we will see, an increase in demand of between 20 and 30%. But we have leaders now right across the organisation, and it was wonderful to see Rosario Mannion, our National Director for HR, here this morning. But we have leaders across the organisation who are leading transformational change so that the health service can be the strongest partner that it can possibly be in terms of this much broader agenda. And just last week, following a very long period of engagement, particularly with our clinical leaders and consultation, we launched our Making Every Contact Count framework, capitalising on the over 60 million contacts that health service staff have with members of the public annually, supporting and enabling our patients and our service users to make the healthier choice. But where we can as a health service, using all of our assets, all of our expertise and all of our strength to do what we can to change the choice architecture for people so that the healthier choice becomes the easier choice. And this kind of change across government, across organisations and even within families, it takes time, it takes a lot of persistence, it takes courage and the need to be brave, and I welcome the Taoiseach's comments to Minister Marcella Corcoran Kennedy in terms of that, because it takes bravery and it takes courage, particularly where we have significant competing interests. But just like the motto in our charter today, health and well-being is at the top of everybody's mind and no one is left behind. So let us work together as willing, persistent, courageous partners to take on this agenda, to play an active part in whatever way we can to make a difference in the lives of all of our children, our families, our neighbours, our communities, where we work, in the organisations within which we work, our co-workers, our politicians, our legislators, and our most vulnerable citizens. As the largest employer in the state, we are ready and willing to play our part. Again, the slides give an example of some of the work that we're doing, the evidence-based key messages, and we are willing to engage and to work and to network the networks, as you can see here, and to support you and work with you, and indeed learn from you in relation to taking this work forward. Today is a very important milestone and I think it represents the next chapter of the Healthy Ireland framework. I was just sitting as I was thinking there that the plot remains the same, but we're going to add lots of more characters to make it much more exciting and to really quicken the pace of what it is that we're trying to do. On behalf of the Council, I would really like to thank the Chair, Keith Wood, for advising and guiding us and bringing all of his best assets in terms of particularly his tenacity to bear on the work of the Council so that we're actually here today. I'd also like to acknowledge Kate O'Flaherty, the Director of the Health and Wellbeing Unit in the Department of Health, who, working with Keith, has made today happen. And I know that my fellow Council members would share that thank you with me. I'd like to very much thank the Taoiseach and the Ministers for their political leadership. It means so much, and particularly having political leadership dedicated to this agenda. As we can imagine, the agenda is very complex, it can be very difficult, but Taoiseach, without your support over the last 4 years, we wouldn't have a mandate to actually lead this work. That political support gives us a mandate to drive this agenda forward and to make that difference. Again, our motto is for health and well-being to be at the top of everyone's mind with no one left behind. Thank you.
Thank you very much, Stephanie. It's interesting when you're listening to some of you've spent an awful lot of time with, and you still get surprised by some of the new elements that come up in relation to it. One of the points on the network is that it almost has to be a national movement, as in an all of Ireland movement, because in the period of our council, 3 years, we've had 3 ministers of health. So this needs to be something that has a level of continuity across the board, because sometimes things change and governments change and circumstances change. We need to build this into the psyche of the people of Ireland, that again, what it is to be Irish is to be healthy in body and mind. And the more we say it, the more it's true, or we'll believe it to be true, and we'll make it true in the future, because that's something that needs to be done. One of the points that we've talked about was collaboration, and I think it's very important on this particular morning to have 2 of our council members come up in terms of what can happen when you put different people in a room. And we have a great exemplar of the kind of partnerships that are possible and that can be achieved at both national and local level. Colin Regan and Amanda McCloat and the GAA Healthy Club Recipes for Success. This all started when they met. I think it was in the second council meeting over was going to say skinny latte or something, but anyway, over something very, very nutritious and healthy, I can assure you, because we had to live it for our council meetings. The food was good but healthy, and it can be good and healthy, no but needed. And so I'd like to bring Colin and Amanda up just to give you an example of collaboration.
Good morning, everybody. I'm the Colin Regan part of the duo, in case you were wondering. Community and Health Manager with the GA, and this is my council colleague, Amanda McLeod, Head of Home Economics at St Angela's College in Sligo. And we are the nominated double act for the council today. And as Keith said, we're going to take you through the Recipes for Success programme, which started with a conversation, not over a skinny latte, over a herbal tea. So really, our starting point for what we wanted to achieve, I guess, can be summed up by this quote by somebody you probably are familiar with, Albert Einstein. One should guard against preaching to young people success in the customary form as the main aim in life. The most important motive for work in school and in life is pleasure in work, pleasure in its result and in the knowledge of the value of the result to the community. And we know, both myself and Amanda, that information on its own isn't just enough, and we wanted to give experience to young people about healthy eating. And we wanted to take that out of the formal education setting in some part and transfer it to a place that they're familiar with and they know and love, their GA club, but partner then with people like their home economics teacher and bring a new element to education back into their classroom. And as we're here today for the launch of the Healthy Ireland Network, we feel that this here sums up what collaboration and partnership is all about. The two lead partners obviously are the Community and Health Department in the GAA and St Angela's College. We're supported very strongly by the Healthy Ireland framework and obviously as well the Association of Teachers for Home Economics. And then we are also supported by Irish Life through their corporate social responsibility support of the Healthy Ireland Network, of the GA Healthy Club, sorry. And I'm going to hand you over to Amanda now, who's going to take you through some of the nuts and bolts of what the Recipes for Success actually means.
Okay, good morning, Taoiseach, ministers, ladies and gentlemen. So the aims of the Recipes for Success was to develop nutritional knowledge and the food skills of young GAA players under 18 and under 21. And in particular, we wanted to try and target more males. We wanted to bring the home economics knowledge, the food skills that it provides out of the school setting and into something that they all love, i.e. the GAA club. We wanted to promote home economics in a fun, practical, contemporary way. And we wanted to link their love of sport with their essential life skills that every student should leave school having, including healthy eating and those food and cooking skills. So the project team set about those particular aims. We're talking here today about partnerships, and partnerships is extremely important. This whole project was built on a partnership. It started, as Colin said, between a conversation between two Healthy Ireland Council members, and then we networked our networks to produce this very substantial project that is snowballing into a real success that we are very, very proud of. But our partnership from the very outset was built on shared values and goals that the home economics discipline supports and the GAA. And they are goals and values of promoting health and well-being, of having empowerment, so facilitating people to be empowered to take the right, healthful choice when they actually go to consume food or the healthful choice in their life. A sense of partnership, willing to have a partnership develop. We were very willing to collaborate and to work with each other, to have innovation, to come up with a new project that will engage the young people of our society in a fun, practical medium that is outside the school setting or outside the formal school setting. However, as I mentioned, we networked our networks, and without those flexibility and the generosity of the time of those at the grassroots level, the GAA volunteers, the Healthy Club officers, right down at grassroots levels in very small clubs across rural Ireland to larger clubs in urban areas, we had the full spread of clubs. and the volunteer of the home economics teachers out there in the schools who came in the evenings, who opened up their kitchens to bring these young males, young females from the GEA club into the home economics classroom and to learn practical food and cooking skills in a fun way. It all started with the development of a toolkit, and I would encourage you all, we have free samples for everybody at our stand at the very back. And this is essentially a toolkit that focuses on the principles of healthy eating, food literacy skills, and as a whole suite of recipes, very fun, practical, healthy recipes, with also an element of sports nutrition built into them. And I want to acknowledge the home economists in the college and Dr. Karina Tobin, who wrote this particular book from scratch, and it is widely available for free to be disseminated out to every young player in the country is our aim. In terms of the scale of the project, it's a very sustained, research-informed project. We started off as a pilot project with 8 clubs in September to November 2015. We evaluated that, we learned from it, we moved on then to phase 2 of it, which we are currently just finalising, and that was 24 clubs, May 2016 to January 2017. We are currently evaluating that particular phase, but what is of real importance to us is the number of males that we have targeted. So we have 170 males and 54 females participated in a practical hands-on cookery session with a home economics teacher, cooking some of the recipes out of our booklet. And in phase 3, we are planning to snowball into 150 clubs, and the target area for that, or the target timeline for that, is January 2018. As I said, we are networking our networks, as Dr. O'Keefe mentioned earlier on, and that's essentially what this project is doing, and that's what we would encourage you to do now as a member of the Healthy Ireland Network, is to network and to as a potential project, this might be an idea for a schedule. So the GEA and the Home Economics Department in St Angela's first of all met. We then moved into home economics teachers in the schools. We networked with those. We got the network set up between the Healthy Club officers at grassroots level and the home economics teachers at grassroots level. And then they would have organised their cookery sessions where they would have brought the teachers in, they would have brought the Healthy Club officers in, and they would have brought the players in, the most important people. The players came in and they would have all participated in a hands-on practical cookery session.
So maybe just to stress the importance of that practical session, I was lucky enough to represent my own county, Leitrim, for 15 years as a footballer, and the first time we had a dietitian in, she was talking about lentils and quinoa to a room of men who had never boiled their own egg. So we took the team out on the road and we went up to Sligo, where St Angela's is based, into Markievicz Park, the county ground, and brought in one of our healthy clubs, Eastern Harps, under 16 and minor squads in to experience hands-on what one of these here practical skills cookery workshops were like. And we made a little video here that can explain kind of what we're trying to tell you much better than we could.
Outside of being a GA player, healthy eating is crucial sort of in our everyday lives. You know, we all have very demanding lives. But then as a GA player, I think it's even more important. You know, we're all looking for an edge on our opponents. We're all looking to be the best we possibly can be. If you have the right fuel in your bodies, knowing what the right fuel is, timing it correctly, it gives you a real edge, and you can see the benefits in training and in matches.
Recipes for Success is an attempt to make available to club players the fantastic information and resources that most inter-county players now take for granted in the area of fueling your body for performance.
So we're really trying to empower the player with the skills that they need in order for them to cook. I think the earlier that you can get teenagers, children in general, to understand that food does have a huge impact on not only their health, but also on their ability to concentrate in school, their ability to play in general, because the right nutrition gives them more energy. It makes us feel better when we eat better.
What we've developed with Recipes for Success now is taking into consideration the needs of club players. We've worked with the likes of Karina Tobin, a top sports nutritionist. We've worked with the team here from St Angela's College in Sligo to develop a resource and an information booklet that is just awash with useful, practical information pitched at a player's level using the language that would be familiar to a player. And we hope that the Recipes for Success resource assists them in overcoming some of those challenges and ensuring that they too, like their inter-county brethren, can perform to the maximum of their capability. So those workshops are being replicated in communities and schools with clubs and young people right around the country. And while we did specifically target that kind of minor under 16 age group, a lot of the adult teams have heard about this now and are starting to come forward looking for it as well. So we're really excited about moving into phase 3 with Amanda and her team. And just speaking of the team, like it's essential really to acknowledge a couple of key people that have helped make this here happen from our side. Dr. Elaine Mooney and Roisin Linden from St Angela's team. We heard from Dr. Creena Tobin on the video there, and then from my own department, Stacey Cannon, Eve O'Brien, and now Ronan Flynn is also picking up the mantle. So in terms of, why we came together as two entities, it was really about sharing a couple of key skills that we felt the other entity had, and that's what partnership is all about. First of all, acknowledging them, recognising them, and putting them into action. For us, St Angela's had that independent, authentic authority voice on healthy eating, and we know that space is contaminated a lot because of commercial interest, and we knew we could stand over anything that we did with St Angela's. The practical cookery skills, obviously, and GA clubs don't have, the majority of GA clubs do not have a kitchen like that they can turn to. However, schools and home economic departments do. And then finally, the network of home economics teachers, and just the fact that they have given up their time outside their school day to make available these here classes has been phenomenal from us. From St Angela's, they saw in the GAA, again, a respected network with a in to every parish in the country to promote healthy eating and what home economics is all about. We had established health and wellbeing structures in place that allowed us drive this agenda through people who were going to champion it. And as we grow now from potentially 60 clubs in phase 2 to 150. We have 1,600 clubs in Ireland, and that's our vision for Recipes for Success and the Healthy Club project. And if you'll excuse the pun, the appetite so far for it has been phenomenal, and we look forward to working together on this project for years to come. Thank you.
From small acorns, it's very interesting watching how that progressed from a small pilot study to get bigger with the potential to going an awful lot bigger. I'm just delighted that Colin shaved his beard. There was birds nesting in that the last time I saw him. It was huge. You could see it there and there, but he tied it up well for today, But it is something that can be done by a group of people deciding that something should happen. And when we talk about the network, we know that we've 280 people and groups that are in this room that are signing up to it, that want to sign up to it. This is the start of the network. We wouldn't have got anywhere near this point unless I think we had our next and final speaker up, Minister Marcella Corcoran Kennedy. I like her department, the Department of Health Promotion. There's something positive about that, and it was interesting listening to Minister Harris talking about almost being the Department of Hospitals and the negative connotation that goes with that. This is about preventative and positive and healthy and recreational. It isn't all about competitive sport, and that's something that's very, very important. So if we can ask the Minister to come up and speak next, please.
Thank you, Keith. Taoiseach, distinguished speakers, ladies and gentlemen, it's clear from this morning's programme that today is a significant event in the ongoing drive to implement Healthy Ireland. It's also an exciting day for me as Minister with responsibility for health promotion to see the whole of society element of the Healthy Ireland take a major step forward with the initial phase of the new network. And I'm delighted to see Anya Brady here. Lovely to see, Anya, that you've retained your interest in health promotion since your time in the Oireachtas. Over the past year in my role as Minister for Health Promotion, I've met many organisations wanting to get more involved in the Healthy Ireland agenda, as they're passionate about promoting health and well-being in their own communities. And that's one thing that I've discovered in the wonderful engagements I've had with people over the last year, whether it's within government departments, whether it's in NGO sector, wherever I've met people. It's fabulous to see the passion that they have for health promotion and the area of interest that they have. And that really and truly convinces me that we're on the right track. This new network will help provide a platform for those organisations to connect with each other, to communicate about what they're doing, and to contribute actively to bringing Healthy Ireland to life across the country. And we've heard such a wonderful example of that with St Angela's College and with the GAA. And I noticed, Taoiseach, that you took a copy of the Recipes for Success cookbook. I'm sort of envisaging you going into the kitchen at home in Castlebar with it under your arm, and Fionnuala's expression when she sees you coming with it. So I've no doubt that you'll have great fun in the kitchen trying out some of those wonderful recipes, because you've got the physical activity side of things down pat, that's for sure. The achievement of the goals of Healthy Ireland depends on the active participation of many sections of our society. Today is an important milestone in achieving Goal 4 of the framework, creating an environment where every individual and sector of society can play their part. I had the privilege of meeting with Keith and the Council at an early stage of the process to establish this network at their meeting last October. And I recall that room was also full of passion to make a difference, to agree a set of values that would resonate with advocates and partners across the country, and to define a purpose and a way of working with the network. Today their vision is being realised, but it's also important to recognise that this is a first step on a new path, and our ambition is to grow and develop this network and movement. Keith and the Council will recall that their first meeting here in Dublin Castle in June 2014 was addressed by Dr. Margaret Chan, Director of the World Health Organization. She described the Healthy Ireland framework as one of the best that she had seen, and that with the launch of the Healthy Ireland framework and the establishment of this council, Ireland had more than a fighting chance of success. This is a carefully orchestrated and united fight in a whole of government and whole of society approach. Engagement goes from the national level to the local, from the heights of academic research to the grassroots voices of civil society organisations, who are extremely important, and right down to families and communities, which is where the action will happen. With today's launch and our ambitions to grow this network over time, I think that we have further increased our fighting chance of addressing the many challenges that affect the health and well-being of our society. There is a reason to be confident that by working together, by including everyone, and by harnessing the enthusiasm of all our people, that we can succeed in building a healthier Ireland. I'm also delighted to see that the many initiatives, campaigns and services which broadly come under the Healthy Ireland banner are here with us today. I encourage you all to maximise the opportunity today to familiarise yourselves with the range of information and advice that they provide, and make some new connections that can help you as you go back to your organisations and communities to think about how to bring the aims of the network forward. I know you'll certainly be inspired. I want to acknowledge the work that Dr. Stephanie O'Keefe and Kate O'Flaherty in the Department of Health are doing. My first engagement with those two dynamos was down at a conference in Galway last year, and I went down to meet them for breakfast downstairs. I took the lift down and had breakfast with them, and we discussed the conference that I was opening. And then we went out of the breakfast room, and I headed for the lifts and the girls headed for the stairs. So I suddenly realised that I certainly had to make a shift in my thinking. And they were wonderful examples to me, and I'm meeting wonderful examples everywhere I go of people who are leading by example. And I think that is how we will succeed. I want to add to Minister Harris's commitment of the Department of Health in continuing to work with you all on the journey ahead. And as Minister for Health Promotion, I'll use my role to help support and facilitate the network in the work ahead, as it helps to spread the Healthy Ireland message all across our society and our country. Thank you.
Thank you very much, Minister. I've consistently been impressed by your candour, actually, in relation to your own health and how you want to be healthier, and not hiding away from the fact that we can all do a little bit more. I'm also interested in a couple of points. There was a touch of the Late Late Show here earlier on. There's a little something for everybody in the audience. There's so much data and information in the back of the room, and this is the start of the network. Take it. Take the leaflets, understand a little bit more, because you'll figure out where it'll work for you in the weeks ahead, the months ahead, the years ahead. And an awful lot of the work that's been up there can be replicated or spread throughout the country, and it really is an absolute treasure trove of data for health promotion for our country. We're near the end of this. As I said, this is the start of the network. Use the opportunity today to talk to people, to see what you can do together. If there's anything else in, all of you sign up. There's digital screens here on the side. Belinda is around, and there's external outside where you can sign up to the actual charter. The more people that do it, the more people will bring this front and centre. I want to thank all the exhibitions that were down there earlier on today, all the work that has gone in for today, all our speakers and obviously our government ministers and Taoiseach for coming in today, just to give that strength of depth and breadth into what it needs to be Healthy Ireland. On a personal note, I would like to say that this has been an awful lot of hard work, that the Council have been very proud of the fact that we've got to this day, that we didn't have any fall off in any of that period of time on something that was very, very vague and very hard to quantify and qualify at the start. But we now know that we're in a position where we have and will have a communication tool to promote the health of the nation from an individual, local, community, county and national basis going forward. So this is the start, but we hope it's the start of something very, very special. Kate's team has got all your details, will be in contact with you over the coming weeks over what the next steps are going to be. But I have to say I'm very proud that today is a first step for the Healthy Ireland Network. Thank you very much for your attention.